Well, welcome back to the Dental Guys. I'm John, the Dental Guy.
And I'm Wes, the Dental Guy.
And this is a very special episode as we continue our coverage from AO 2024 here in Charlotte. We have had just an amazing already group of people that we've gotten to speak with as we've discussed a lot of controversial topics, a lot of very important topics. Again, a focus of many discussions on peri-implantitis. Always this meeting brings some of the best together.
I can't imagine not being a part of an organization like this. And I know that we, John and I have been members of the academies for such a long time. We believe in what the academy's doing, and I would encourage any dentist that is restoring, placing, involved with dental implant education, they need to get involved with an organization like that. And like this is, it's taking it to the next level, and that's what we're about, John.
That's right. And so with that in mind, our next guest is rather important.
Just a little bit.
So we're happy to have Dr. Joerg Neugebauer here with us, who is the incoming president of the Academy. Thank you for being with us tonight.
It's my pleasure.
We're very excited to have you. And we, like Wes said, both of us got involved with AO many years ago. In fact, both of us were through the outstanding implant students at our schools. So I remember Tom Taylor giving me the Jomi and saying, "Hey, you're a member now, basically, or this is such an important thing." And he said, "You need to go to the meeting." And I went to my first meeting in 2008, and ever since I've been coming. And so I wonder, where do you see this meeting? Why should people be here? We know the answer, but we'd love to hear from you. What's so important about this meeting?
So we are really happy to be back in person with these meetings. So it was a very large lack due to the pandemic situation. And we are a group of multi-specialists. And so we have the possibility to communicate on our board. We discuss the things from different levels. And in the recent decades, we could say now, we have accomplished a large amount of knowledge. And it's important that this knowledge will be transferred to the general dentist, to the daily practitioner. And here is our goal, and this is also important, not to only to distribute it, like you mentioned, with the Jomi, or some other textbooks. It's important that we have the personal interchange. Because if we discuss with each other, we get another seeing, another understanding. And I think this is important to have this also with in-person meetings.
One of the things that was mentioned today is the organization itself is really growing. And you guys have embraced the international community as well, outside of the United States. Speak to that.
So if you look to the American or North American organization, quite often they are in a closed situation, just focusing on the North American market. But if you look especially to the implant treatments, there are a lot of impulses from other countries, from other regions. And here with the AO, we collect all this. We have a large group coming every year from South America. Homele Wang expanded especially to the Asian region. I'm one of the representatives of Europe, bringing my friends, my colleagues over, and so we can look this on different perspectives. So we have different education, for example, in Europe with the dental technicians. And if you go to a dental lab in US, it's completely different than in Europe. And so to exchange this knowledge, I think it's really important, and to give an insight how you can solve the case on an easy manner.
Yes, and I think the comment about in-person education, in-person meetings, it's interesting because I think, Wes and I, we met each other at an in-person meeting in Sweden years ago. That's where we first met, at an implant meeting. And we, as much as we're doing the podcast as a way of getting maybe the message out, the message we'd love to get out is you need to be in person. That you can't learn how to do excellent implant dentistry from social media. We have to be here, even though we see the value of all of that. And I think that, it's the conversations we have after the lectures even sometimes that are the ones that change our practice the most. Do you see that as well?
If you look to the audience hall, if some controversial things are going on the screen, you see how people tip each neighbor and then ask, do you think this is real, what he's showing us?
Yes. And then you know you're onto something.
How many times did that happen today? Like one time I feel like I knocked him out of the chair. and some of it is confirming of what maybe we believe. Some of it's like, do we really think that that's what's happening? And then afterwards you're getting together with friends maybe across international borders. And I think it's fantastic to discuss what's possible today with other clinicians and really building your skill set as a technician when you go back and apply these things. It's the research, it's the collaboration, it's what your friends are doing. It's all coming together to help you make a better clinical decision for your patient come Monday.
So what's happening in the next year with AO? You know, what are some of the goals, some of the focuses that you might be having with the organization?
So we have multiple focuses discussed just a few days on the board meeting. So once we had set up 2 consensus conferences, once this year with the AAP, the next one will be together with the EAO and the newly formed Aussie Alliance. So we are looking once again on specific topics on the science, but also today we already discussed how we can transfer this knowledge again to the public domain. How will this knowledge help the daily practitioner to treat the patients better? And especially if you look to the theme of our Seattle meeting, we have a lot of knowledge. Sometimes it's controversial. And this is also the theme. We have all these controversial things, but finally we have to look how we make the daily treatment easy. And this is also a focus, especially for the general practitioner, because they have not always the opportunity to send their patient to the perio, to the surgical specialist and to the prosthodontist. They want to keep their patient. And they look for a solution for the patient. And I think the worst thing is if a dentist is looking to the patient to a situation, I cannot do this, I cannot do that, and so I refuse the best treatment for this patient because I just want to do a removable denture.
If you look at the data right now, dental implants is right on the precipice of actually launching off into more implants being placed than ever before because of an aging population of baby boomers and other circumstances. And general dentists have been lumped into placing a lot of dental implants now. And you mentioned a general dentist as a partner, and one of your goals is to bring those people together. Talk a little bit about how you've included general dentists into this organization.
We have dental dentists as one specialty on our board. So we are looking that we have not only the periodontists, oral surgeons, prosthodontists, we also have general dentists on our board. We are looking also in the composition of our committees that we work together with a general dentist. So it's important that they have their role in our organization, and we want to support them in their daily work.
What's been interesting, talking to general practitioners who you're getting out of dental school in a very, I think, unique situation these days compared to 20 years ago, 30 years ago, and they're trying to make decisions about their practices, and oftentimes they're concerned about, well, where should I spend money on continuing education? What are the things that will matter to me? And we believe that this organization has always been sort of the leader in trying to take what's happening at the highest levels of research and clinical and actually develop consensus on things, and that directly benefits everyone, but especially maybe the general practitioner who's trying to figure out what's predictable. I know you've got a lot of focus on young clinicians as well, and speak to that a little bit. What is the place if a young clinician comes here? What are some of the things they can expect to get from this organization?
So once we have our young clinician committee, so where we especially have lectures and also people who can be contacted. So it's not always a big distance between the gray-haired board members. So we need a contact between the young people. And if they have a question, if they need support, then they can come back to the elder persons, to the more experienced person, to get the exchange of knowledge. I think this is very important. And so also we have set up now our hands-on workshops during the annual meeting. They are very well accepted, so they are sold out. And dentistry is something where you have to use your brain, but also your hands. And we're coming back at the beginning. You cannot practice your hands on social media. You can practice your thumbs to be very quick on the iPhone, but you cannot practice how to work with a scalpel, how to work with elevator and things like that.
I think it's great. Seattle is the next meeting location. Seattle's a town that's near and dear to John and I's heart. We really love the town. You guys have chosen that for the next meeting. Talk a little bit about what's going on there in 2025.
So we have our 40th anniversary, so that's also a big time to celebrate. We have focused our program scientifically on these controversies, on these huge amount of knowledge which is available, and we want to break it down with the different sessions. So we have counterpart sessions where we have two speakers on one theme, and they have the possibility to show their options, and then we have also a combined discussion on each topic.
Very good.
Some of the best AO meetings have been point-counterpoint.
Yes.
Where you have two speakers, and basically what you need to understand is two people coming together not to argue, but to present in a fashion that you can collaborate and say, well, he said this, and then from that comes actually some decision making that you can take back to your
That's
home.
right. It's the part of consensus, and sometimes that begins with two very opposing views, two very passionate people, and that's what AO has always encouraged. You know, and I've been to AO meetings where people very passionately disagree, and yet they go have a drink afterward and discuss, you know, what can we do about this in our practice? And it sounds like the Seattle meeting, we're going to see some very exciting things potentially, and maybe help to answer some questions. So I'm looking forward to that. And
It's exciting.
Yeah.
It's exciting.
Well, any other things that if you would say to someone, or if someone was to ask you, why should I join the Academy of Osseointegration? If you could give us your answer to that.
So I get often this question in Europe, because why are you traveling to US? So we have a lot of clinicians and scientists in Germany. You go to the German meeting. Yes, but this is only one piece of the cake. And I enjoy really here the different approaches, the different cultures, the different feelings, and also the different level of discussion. And I think this is really important to get on the next level. Because if you're only sitting around with your old friends, you're doing always the same. And always when I come home, and already my partners texted me, what have you learned? What will you bring home? And they don't do that if I go to a German meeting. They know that I will bring more home than from the other meetings. And this is culture here of the AO with all these multidiscipline specialties taking care for one topic, to place an implant and to restore an implant in a patient.
I keep coming back to this, John. This is a great show title, Going Beyond the Boundaries. If you're at home and you're setting your boundaries by staying in the same place, practicing with the same people, not questioning yourself, you're living in a vacuum, and that's very dangerous. We've said this before. If you want to take it to the next level, the AO might be the organization. We think it is. To really come together and collaborate. I think it's fantastic.
That's right. Well, thank you very much for being with us. We really appreciate that and look forward to this next year with the AO.
Thank you very much. It was a nice evening.
Absolutely. Well, if you've listened to this and, hopefully we came across as this is what we believe in. We believed in it for many, many years, and here we are with the president. Kind of, you can, I think, hear the passion that he's got for what this organization does for clinicians from almost any background that we can imagine. So if that, hopefully you're already looking for the save the date for next year.
And if you're interested in that, head over to osseo.org right now, and you can click on membership. It'll tell you how to apply to become a member of the AO, but also you can look there and click the annual meeting. It's right on the home page there where you say meetings, and you go right down to annual meeting 2025. You'll see it.
Or you could look at 2024 and get some FOMO, fear of missing out, because you're not here.
Yeah.
So,
we're here.
Yeah. So I think if you want to really see what's going on and why we're so excited, just look through the program and see who's speaking and the topics, and I think you're going to catch that same passion. So it's been really great to have the president on. Thank you again. And for Wes, I'm John. We are the Dental Guys.